Synovial joints are by far the most common joints that we will see. The majority of the joints that we look at in the body are synovial. These are very mobile and motion is usually limited by overlying structures such as ligaments, muscles or tendons, or apposition of soft tissue structures or bony tissue structures. All synovial joints have chief characteristics. The articular surfaces at the bone ends are virtually always covered in hyaline cartilage. Occasionally, joints will be covered in fibrocartilage instead of hyaline cartilage. The hyaline cartilage can be seen here, this blue area. And hyaline cartilage is a structure that is developed for weight bearing. Its molecular structure is such that the more you weight bear on it, the stronger it gets. It also provides for a smooth, friction-free surface for motion. Degeneration of the hyaline cartilage is known as osteoarthritis. The joint is then surrounded by a fibrous capsule, as can be seen here, the green area around the outside. The fibrous capsule has got two layers of tissue. It's got the external fibrous membrane, whose primary function is for containment and stability, and it has an inner fibrous layer known as the synovial membrane. The synovial membrane always attaches to the articular margins, in other words to the edges of the hyaline cartilage. The role of the synovial membrane is to secrete synovial fluid into the joint cavity. Consequently, it is a highly vascular structure and a well innervated structure. It's a very sensitive structure, so impingement of the synovial membrane is often extremely painful. The external fibrous capsule, however, usually attaches beyond the articular margins. This is usually tough. It may or may not be sensitive, depending on the joint itself. The fibrous capsule provides a degree of limitation to movement, but this is further supported by external fibrous structures, as we see here, known as ligaments. Ligaments are bands of dense connective tissue, dense regular connective tissue that attach bone to bone. Ligaments will invariably span a joint. Each ligament has a specific role to limit a certain movement in a certain direction. Ligaments may be thickenings in the capsule. Occasionally they may be separate from the capsule, and very occasionally we will find ligaments inside a joint. Intra-articular ligaments. When a ligament is inside a joint, it's usually surrounded in a covering of synovial membrane, the function of which is to prevent the ligament itself from being bathed in synovial fluid. Occasionally, we will see synovial bursae. These are pouches of synovial membrane that are found outside the boundaries of the capsule, and the function of these are to protect overlying structures from rubbing or from friction against bone margins or joint margins. These again are sensitive structures. They are highly vascular. They are pouches of fluid that contain synovial fluid. When they get inflamed, they can produce a severe amount of pain. The synovial fluid itself is secreted by the synovial membrane. Its primary function is nutritional. It has all the nutrients for the hyaline cartilage. Hyaline cartilage is completely avascular and completely aneural. It has no blood supply and no nerve supply. So hyaline cartilage cannot bleed and it does not cause any pain. Because it has no blood supply, it has to rely on its nutrition from either diffusion through the synovial fluid or from diffusion of nutrients from the subchondral bone, the bone that lies immediately underneath the hyaline cartilage itself. Synovial fluid also acts as a lubricant. When you feel synovial fluid, it's very slippery, it's like an oil, and it has the function of allowing the joint surfaces to move over each other smoothly. Occasionally, in between the articular surfaces, we may find a fibrocartilaginous disc or meniscus. The classic one is the meniscus in the knee, the cartilage that footballers commonly tear as a result of weight bearing and suddenly twisting on it. The role of the meniscus is to improve the congruency between the articular surfaces. It has a secondary role to act as a shock absorber and weight dissipation, and there is some debate as to its role in producing further lubricant to the joint itself. The disc or meniscus is invariably avascular again, has no blood supply, and it's usually aneural, so that when weight bearing there is no nerve endings within the meniscus to cause pain.